Thank you for the introduction. Good morning, everyone. Today we have been hearing a lot about mobile health technologies and their potential in many contexts of the healthcare. And of course, using a smartphone, like an app on our smartphone or a wearable, is really appealing for many reasons, because we can have very accurate and up-to-date information about our health in our pockets or on our wrists. And this information could be used by clinicians, for example, to create more accurate and personalized therapies. And this is true especially in those medical conditions in which the symptoms are not stable, so they fluctuate a lot across the day, and so they are very hard to capture for example, in a single visit to the clinic of a few hours. And this is also the case of Parkinson's disease. Parkinson's disease is the second most common neurodegenerative disorder after Alzheimer's, and it affects 7 to 10 million people worldwide. And in the US alone, it's approximately 1 million. And these numbers, of course, are increasing because of the age of population. So we have almost 6,000 new diagnoses every year in the US alone. And this also has a very huge impact economically, with costs that are estimated of around $23 billion a year. But what is Parkinson's disease? So it's a neurodegenerative disorder that is caused mostly by the loss of neurons, dopamine-producing neurons, in a region of the brain called substantia nigra. And this affects mostly the motor ability of the subjects, with symptoms such as tremor, slowness of movement, rigidity, and postural imbalance. And there are also some non-motor symptoms like depression and sleep disorders and cognitive impairments. So the main medication that is used to manage those symptoms is levodopa, that has been around for quite a lot of time, and it's very effective, especially in the early stage of the disease, but eventually patients start experimenting motor complications, such as dyskinesias, that are these abrupt involuntary movement, or motor fluctuations that basically are a roller coaster in the severity of symptoms from one medication cycle to the next. So it's very important in Parkinson's disease to have a good and an accurate and effective titration of the medication. And to do so, right now the PD specialists rely on a set of tools that mostly consist in a visit in the clinic of a few hours, in which they assess batteries of standardized tasks by the subjects, and they assign a clinical score to their motor performance. And these scores, of course, are qualitative, so are basically based on the experience of the clinicians. And to monitor the dynamics of the symptoms outside the clinic, they rely mostly on self-report by the patients that have been proven multiple times to not be reliable. So there is a clear need of an objective and continuous monitoring tool for tracking these symptoms dynamic. And mobile health technologies are a perfect fit for this application, and in fact they have been widely investigated for a lot of years. In my lab, in the motion analysis lab, we have been working on this for almost 2 decades. But the main approach used so far was to try to mimic the clinical evaluation by the clinician, so basically having the subject performing a set of standardized tasks. And we proved, for example, that using wearables, we could estimate the score of the severity of the symptoms in an automatic way using machine learning algorithms. We also tried to bring this system in the patient's home using a remote assessment tool based on the cloud and on wearables. But the main limitation of this approach that has been used a lot also by other research groups is that it's still based on the performance of these standardized tasks that are not really convenient for the subject because they need to sit there and perform these tasks multiple times within the day if you really want to capture the fluctuations in the symptoms. And also, if they do so, it's not always true that we are able to capture the really fast fluctuations in some of the symptoms. So in recent years, we have been focusing mostly on developing algorithms for this objective and continuous monitoring of symptom severity during activity of daily living. So basically, try to estimate the severity of symptoms while the subjects were doing their usual activity during the day. And to do so, we needed good data. So we have been collecting data. We started in 2015 with a project in collaboration with the Michael J. Fox Foundation. And we had a data set in which we were monitoring people with PD for 4 days. And we had visits in the lab and also a portion at home. But the main problem there was that it was really challenging to validate the algorithms that we were developing using the data in the lab in the home part, because we didn't have a way to observe the subjects while they were at home. So we recently collected a new data set in collaboration with Pfizer, in which we had both a portion of the data collected in a traditional environment, so in the lab, and also we had with a set of wearable sensors and cameras, and we had also clinical personnel giving real-time clinical score to the subjects. And then we also had a second portion in which we asked the patients to stay in a simulated apartment for like 5 to 6 hours, and they could like perform whatever activity they like making a sandwich or watching TV or playing a game. Still wearing the wearable sensor, and we had also cameras, so we could actually assign scores in a second moment. So we were able to use this data to develop original algorithms for the estimation of the symptom severity during this activity of daily living. We use both traditional and deep learning techniques, and we actually are able to achieve a very good time resolution also for example, in the picture you can see a tremor severity estimates across the 2 full days. And you can see the vertical black lines are the medication intakes. So you can observe that the variation in the severity, it's very different from one medication cycle to the next and from one day to the next one. So we're really excited about these first results, and we are now working on refining these techniques and to apply them not only to tremor, but also to dyskinesia and bradykinesia. So we are still in the process of publishing the first preliminary results on this topic. And as I was saying, also to refine these algorithms. We, of course, are always open to collaboration and partnership. And I just wanted to spend a word to thank my research group at the Motion Analysis Lab at the Spalding Rehabilitation Hospital, and some of the people that have been working on this topic, former lab member that have been working on this topic for like the last few years. Thank you very much.